Hey everyone, welcome back to The Dish. I'm Anna Christina, and listen, just because we're headed into the colder months doesn't mean we can't focus on tightening up our bodies, and I'm so excited because there's a new procedure being offered. So I've made my way over to the new Augusta Plastic Surgery. It's absolutely beautiful, and I'm joined by Dr. Chris Ewart. Dr. Ewart, thank you so much for having me in your office.
Yeah, glad to have you again.
So I'm so excited about this, and I know you will be too. There's a new treatment that you're offering. It's called BODYTITE. Let's introduce people to what that is and how it works.
Yeah, absolutely. So I'm super excited to present this. So basically, procedures now are moving toward non-invasive or minimally invasive procedures, and so we're trying to stray away from surgery because there's scars, there's downtime. So if we can do anything that kind of minimize that, we try to. And so now we have something called BODYTITE Pro. And what that does is basically it takes away the need to do, like, for example, a full tummy tuck or a neck lift if we can just need a little bit of tightening. And so this is something that can do that.
That is absolutely incredible, and like you said, it's minimally invasive, so you actually don't have to go under anesthesia.
Yeah, exactly. So there are some times we may need to, but actually a lot of times we can just do this under local anesthesia. Yeah. So it's something that's kind of easy in and out, and that reduces the recovery time even further.
That's so exciting too, and I think that one of the things that you mentioned is scarring. I think that with surgery, people are coming in, they want to feel better about themselves, but then they end up with the scars, and they're kind of, this eliminates all of that because the incision is super tiny.
Yeah.
Talk about how you use a wand. Talk about how it works.
Right. So extremely small incision, and then basically it's has two parts to it. One actually goes internally just underneath the skin, and one above, and it's a radio frequency and actually heats the tissue. Wow. And before we've treated the top of the tissue and done regular liposuction. We actually would stick under, but it didn't really heat the tissue well. Smart lipo didn't really heat the tissue a tremendous amount, but this actually heats the tissue enough to make a significant difference. And what I'm talking about is upwards of 30 to 35% tightening of the skin, which is a visible amount.
Right, that is incredible. And we talk about results. People see results almost immediately. But then the even better part is that 6-12 months from now, they're going to continue to see these results.
Right, that's the amazing thing about it. So it's not something that takes time to see the results at the beginning. You actually see some initial results with it, and then 6 to 12 months later, you see even more improvement. So it's fantastic.
That is so exciting. I know for people, they're like, all right, I'm going to get on that. Right? So let's talk about the different areas that people most commonly would treat.
Right. So basically we'll treat, like in females, we can treat the breast, but the most common areas are probably going to be the neck, the abdomen, the inner thighs, and what it was impressive is the knees. So there are a lot of patients come in and they have a lot of loose skin above their knees. I'm like, I really don't have anything to help you with that. I mean, but now we can. It's impressive.
That is so incredible. And so we talk about downtime with something like this. It's not like surgery where you're going to be out for 6 weeks. It's a week maybe.
Right, very short, very short. You know, with surgery and even like a tummy tuck, for example, that's up to 6 weeks of downtime, and this is something where if you're a good candidate for have this done, it can be just a couple days to a week or two, and you're back doing almost everything.
Well, one of the most incredible things too, going back to the different areas that you treat is the breast, because people that, you know, maybe have gained in this area or have had breast augmentation, but they want a little bit of a lift, they can do that without surgery. This actually will help that. Yeah,
I've been amazed by just seeing some of the results that you can get from that. So basically, instead of actually making those lollipop incisions to lift the breast up, not everybody's a candidate for this, but it can actually provide some lifting where you don't have to have those scars. Surgery. So it's impressive.
That is impressive. Well, Dr. Ewart, I know that people are just going to be flocking through, flooding the door to get that done, because this is awesome. You don't have to have the scarring. You can come in and get it taken care of, get your body tight, right?
Exactly, exactly.
All right, if you want to set up a consultation, be sure to visit augplastic.com or call their offices. The number is on your screen. Thanks so much.
Yeah, thank you.
All right, don't go anywhere. When we come back, we'll have more on The Dish.